I'm Amy Hearn and I'm a Digital Inclusion Coordinator on the 100% Digital Leeds project. Here we go. So 5 minutes is not a very long time because there's lots and lots that I could talk about and could talk forever. So please let me know, Roz, if I'm going over, which I absolutely will. Okay, so I'm going to go really, really quickly. So this is our team. We're just a small team. We're part of the council and we are working across the city to try and make Leeds the most digitally inclusive city in the country. And we're doing that by looking to work with third sector organisations and other organisations that are already reaching our target audience of adults in the city that have got low or no digital skills or struggle to get online for whatever reason. And we use a strengths-based collaborative approach, so we don't really have any set way of doing things. What we do is trust that the organisations that we are working with understand their clients or service users, understand their needs and barriers, and what engages them and all those kinds of things, and help them to understand what they can do to support the digital inclusion of their clients and help them to remove any barriers in place to stop them doing that. And that'll become more apparent how that works when we talk about digital health hubs in particular. So there's a couple of things that we look to do, and we look to our three main sort of strategies around the main shared barriers to digital inclusion. So around skills, we're looking at building a network of organisations that are all working together to deliver different digital basic skills learning opportunities, so that everyone's got something that is going to work for them, that's tailored to the approach that's going to work for them, using the established skills and understanding of the organisations and how they can best support their service users. So access, so looking at increasing the amount of free Wi-Fi in the community, using our tablet lending scheme to allow organisations to pilot different approaches to digital inclusion and improve the connectivity of their clients. Giving out grants so that organisations can spend money on connectivity and other things, and also signposting to different opportunities. And then motivation, our main strategy on that is our digital champions scheme. So we've trained nearly 2,000 digital champions in the city up to date, and we're trying to reach anybody that's working on the front line to help them to understand the digital inclusion picture, what the needs are of their clients, and how they can tweak their delivery to mean that they are instilling a positive attitude towards digital and signposting their clients to extra help and support. So there's a few things that I could have talked about today, and I thought I'd just mention them in case when we get onto the 20 minutes, we don't have very much to talk about on digital health hubs, so I'm sure we will. So we've got some work around My COPD, which is an app to help people with COPD to better understand their condition and self-manage it. We've worked on the NHS Widening Digital Participation Dementia Pathfinder, which was looking at different ways of using technology, digital technology, to support people with dementia and their carers. Increasing digital access across care homes in Leeds during the pandemic, and also our newest piece of work that's got a definite healthcare focus is working on two place-based approaches in two of the most deprived areas of Leeds, looking at how we can bring everyone together and using the digital health champions model. But the one that I'm going to focus on for the probably 2 minutes that I've got left is digital health hubs. So this is where, and this is a partnership between 100% Digital Leeds, NHS partners, also the Good Things Foundation, and Crossgates and District Good Neighbours, which is a local neighbourhood network, an organisation supporting older people in the Crossgates area. And a health hub is a linking of an NHS and other healthcare providers with one of the local community organisations that has got an established and trusted relationship with the people that they would like to, or the cohort that the health services would like to connect with and offer support for. So it's a mutually beneficial relationship where people can be signposted both ways. So it's about the Crossgates and District Good Neighbours being supported to understand the digital exclusion needs of their older clients, and to look at the different ways that they could support people to be more digitally included across the board. So that includes providing more connectivity options. They've established their own tablet lending schemes so that older people who might not understand the relevance to them and why they should invest in such technology can trial being connected and take it home and whatnot with a view to buying it themselves. They're also embedding more digital stuff into their general day-to-day work, whether that might be running things like Zoom calls around bingo and things like that, or it might be extremely light touch. We talk a lot about pairing the known with the unknown when it comes to digital. So something where an older person might be extremely familiar with, that they can stay in their comfort zone with, say something like jigsaws, for example, finding a digital version of that. So a jigsaw app is a really gentle way for them to start building up their digital skills and confidence in a really light touch way, in a setting that they're already familiar with, with people they're already familiar with, that helps them build their confidence. And finally, it's about pairing up with local health sector organisations so that the Digital Health Hub knows what kind of things people might need support with in accessing healthcare, and also that the healthcare providers can signpost people back to the Digital Health Hub for the support they might need to access those services.
Thank you, Amy. That was a real gallop.
Sorry about that.
There's so much behind all of that, so much detail behind all of that, so I'm sure your session is going to be really interesting. Next up is Pete Nuckley, who's going to be talking about the NHS Widening Digital Participation Pathfinder project, which mHabitat delivered with South West Yorkshire Partnership Foundation Trust. Now, Pete is currently working for Good Things Foundation, and he headed up the NHS Widening Digital Participation Programme. And I'm delighted to say that he's going to be joining mHabitat as our Deputy Director of Delivery in mid-October time. So you're uniquely placed, Pete, to sort of stand and talk on behalf of both those organisations. Over to you.
Thank you, Ros, or boss, I should say. Thank you. So hello, everyone. As Ros said, I'm Pete. I'm currently at Good Things Foundation. I'm going to talk a bit about the Widening Digital Participation Programme. So it's been a 3-year-long programme where we were trying to answer this question. I'm going to whiz through a lot of slides with a lot of words in. I've shared the slides in the chat panel if you wanted to look further, because there's lots of links out. So don't worry if you don't read some of the stuff, I'll just whiz through it. So we're trying to answer this question: can digital inclusion in healthcare reach the furthest first and improve their health? Over the course of 3 years, which it's just finished, we engaged and supported about 280,000 people with 23 pathfinders. And we call them pathfinders because, well, I guess we're pretentious, but realistically what it means is 12 months worth of us just finding stuff out through Codesign to get an area to like stage 1. We're not saying we have the categorical answers. But what we do know is from our evaluations that if you invest in digital inclusion, the NHS system gets about a £6.40 return on investment for every pound that it invests. And we use this thing called Codesign. Now, this is my interpretation of what Codesign is. Other people will have different interpretations. But we want to work with users or patients, health professionals and local organisations to see what works and what doesn't and why. I've been running it through this Widening Digital Participation Programme through 6 key principles, which if you go on the slides you can have a look into a bit more, but I think I can't impress enough how important I think this one is. And this one is go where people are. And by that I mean, when we were doing some stuff with the homeless community in Hastings, we spent time under Hastings Pier at 4 in the morning to discuss with them what their problems are, what their barriers are, not inviting them to a posh kind of meeting room where we can sit down and discuss stuff with them, because they tend to either not come or want to say yes to us. We want to kind of shift that power. So that's probably the most important thing. But I want to do a bit of an example of the mHabitat one, which are going to be my new employers, so I should hopefully do them justice. With the mHabitat Pathfinder, we wanted to figure out if digital and more accessible design can help those with sensory impairments. And I'm not saying we got a categorical answer for all this, but we got some really good stuff out of it, and that's what the Pathfinders are for. So we go where people are. We went to visit both Cavan and BLA, which is a a deaf centre and also a visual impairment centre, and we talk to people just in their normal day-to-day when they come across. And these are some of the things we found, like if you have a sensory impairment, you spend at least half of your 7-minute GP appointment trying to figure out how to discuss things with them, or try and figure out what technology you're going to use, or if you need an interpreter, you don't get to talk about your stuff. And the other thing that projects tend to do is, if you're talking about people with hearing impairments, they tend to focus on your hearing impairment, not when you've got a sore knee or the flu and you want to go to a GP. So we were trying to focus on that end of stuff. So there's some things to have a look at there that we found out. And then we got a load of stakeholders together. And some of you will know BB, which is the bottom dog there. And that's Victoria Betton's dog. And then this is Isabel at the top, which is Molly Watt's guide dog, or CNI dog, I should say, sorry. And what we found out is stakeholders actually understood a lot of the problems that users were going through, and it overlapped quite nicely, which is really positive. However, they're a bit scared of the tech for obvious reasons. They don't have time to invest in this stuff or invest time in figuring this stuff out. And even though they know the journey is awful, they sort of just, people have to get on with it because GPs and GP practices are so busy, at least the ones we spoke to. So what we figured out was a couple of ways. So what we needed was 2 avenues, I guess. One is patients or users need to be aware of what technology that is out there. And also, a lot of the users have peer organisations who can help them and help them get the best value for the stuff that meets their needs. Like, we had one person who spent £500 on a whole new system in their house. And when she met one of our peers we were talking to, they figured out that a £50 little magnifier on their mouse would have done the same stuff. So peers are really important. They kind of understand the problems that you've got. So we need to get people involved in that. And then also we need to sort of get GP practices to be a bit more open-minded. And I don't mean that negatively. There's reasons to be risk averse, but they need to think about accessibility from booking an appointment all the way through to you getting your prescription and everything in between. And it's not always digital. So some of the things, some of the outputs, and at the end, you'll see a link, about 100 links of different things that were output for this, which they're all open source. Feel free to go and have a look at. But essentially, we've got a load of digital tools that the NHS apps library is now proven. So that takes away some of that fear, hopefully, for GPs and general practitioners and their practice managers. We did a couple of accessibility training days for GP practices, which was literally walk them through a journey with some goggles on that kind of impair your vision, or with some mufflers on that impair your hearing, so you can see what happens. I guess there's some really valuable things in there for practices across the country to kind of put into effect, but this is why we do it. This is Mark, who only had a tiny bit of hearing in one ear because he had this degenerative problem. He didn't know about the patient's online stuff, but he went there eventually, and now he's really happy, at least booking his online prescriptions. And that's all we wanted out of this stuff. We wanted the journey to be better. Or Ada, who has rapidly deteriorating sight, we showed her a couple of apps, or her peers, I should say, showed her a couple of apps, and she just likes the magnifier function. She's not embarrassed anymore trying to ask people about stuff. I've got a little bit of an anecdote, which wasn't particularly from this Pathfinder, but a friend of Good Things Foundation was talking about when he goes to his GP seems a bit scared to email him the results to his stuff. And his phone can read all that stuff to him, even though he's blind. Obviously, his phone can read that stuff out to him. So he wants the stuff emailed. But what happens is the GP has to send him a letter. So he has to get a letter from his GP and take it to his next door neighbour to say, what are my results? His big joke is, it's a bit embarrassing when you've got syphilis, but we'll move on from that. But genuinely, that just doesn't feel right. And it's right, the print button is right next to the email button. It just feels like we can move this on a little bit more. So I only had a couple of minutes. The last slide is all those links. So for every one of our Pathfinders, you get this amount of stuff. Each one of them links there is a link out to a paper or a document or something we found out. I think the thing about co-design is not about proving it explicitly at the first point. It's about just moving things forward and trying things and making sure that they work, or why they don't, so you don't invest more. Thank you.
So I think that people who go to Pete's workshop are going to hear a few stories like that. Brilliant storytelling there. So we're next up is Ian Brewer, who's a Financial Inclusion and Business Development Officer from Bradford, and he's going to share some of his really interesting work and important work on anti-poverty and financial digital inclusion.
Thank you very much for inviting me along today. It's a great joy to be here. So my name is Brewer. I'm the Financial Inclusion Officer for the Bradford district, but also now for the Kirklees district and the Craven district, as we cover all of those areas. So what I'm going to talk today is a bit about the credit union as a whole. Credit union is a way for people to save collectively. We have 8,000 members, and altogether we save £6 million together, which is a staggering amount. We do really well in getting people into the savings habit, and we also do loans for people that need loans as well. But ultimately, getting people into the savings habit is what we're here for. So my background is actually community development, and I've done that internationally in places like South Africa and India. So when I joined the credit union, I was given the scope to develop not only just financial inclusion, but also develop those community development partnerships and networks that are so important to the work. So let's move on to the next one. And sure, I should just share my screen. I think it'll be easier from current slide. There we go. So one of the things I was able to create from the networks that we did, I've been there 4 years, is the anti-poverty events group. Bradford has an anti-poverty coordination group, and I was working with the policy officer at council, and we developed a partnership. So last year, this is just what happened last year, we developed win-win partnership projects. So we did things like Surviving Summer, Build a Better World, Loan Sharks and Monsters, which we're about to launch again, making use of Halloween and the whole thing about horror. Buy Now, which is an alternative Black Friday, but relevant to this is the Safer Internet Day 2020. We've done that for the last 4 years, and we'll be looking to do that next year as well. And we want to combine that with the national census, and we're getting some ideas around that. So, but we've also done community conferences. We've done 5 of those. We've seen 470 community practitioners at those 5 ones, and we did 132,000 estimate reach from that. Let's see for the next one. So one of the other things that we came out of the work that I do with the Anti-Poverty Events Group is that I do a Money SOS course. It's a free course for an hour that engages people, and it explains things like APR and things like that people very difficult to understand, and help people to understand their money and budgeting. I teamed up with the Social Prescribing Network. We ran a pilot last year that featured on BBC, and I'm working with people like Emma Taylor from the Airedale Group to try and develop that to make that more inclusive. So that's a bit of an overview, which I'll unpack more in my session, but back to you, Ros.
Thank you very much. That's so interesting. There's so much going on there. You must be a very busy person. Last and absolutely not least is Jon Beech. He's the director of Leeds Asylum Seekers Support Network, and I think he's one of the most intelligent and principled people I know, actually. And he really understands social change more than most. And I think he's going to share his perspective now on data and digital poverty and social change.
I work for Leeds Asylum Seekers Support Network. We're a small charity based in Leeds, and we work obviously with refugees and asylum seekers. I wanted to start today by telling you a couple of stories around digital poverty. The first one is about asylum seekers who are staying in hotels. At the moment in Leeds there are about 300. That's because the Home Office accommodation, the initial assessment or the initial accommodation is full, and they're having to use hotels as temporary. And those are arranged by the Home Office through contractors. Everyone who's there has arrived recently in the UK, and mainly with the clothes that they stand up in, right? Many don't have a phone, they don't have any money, they don't have any credit, they're unable to leave the hotels. And so when we were talking about the people opening up the hotels, we're going, are the business suites working? Well, no, we can't let people on the business suites, but we turned the Wi-Fi on. But that's great, but you need a device for that, right? And there weren't any devices provided. Not everyone has a smartphone. So when we heard about this, I mean, about 24 hours, we supplied a couple of desktops with webcams that could be used by people, pretty much. And we heard that within half an hour of installing these, there was a queue of 30 people snaking around the lobby, trying to get on the computers. Hopefully in a socially distanced way. Though in fairness, they're all in a bubble in the hotels in our area, so we're all right. But the point being is that many of those people had arrived in the UK within the last 3 or 4 days, some of them, and family didn't know where they were, loved ones didn't know, people didn't know that they were safe, nor could they access anything, health or legal advice or anything like that. So it's pretty important in the scheme of things to be able to get access. That's the first story. The second story is about refugees. People have got a right to stay. And last Friday, my organisation helped to secure some money to give 12 refugee community organisations a digital pack. So refugee community organisations are small organisations based usually around volunteers, community activists, so it's people like the Ethiopian community or the Eritrean community or Kurdish people or whomever in Leeds. And they're often really quite loose arrangements of people. And one of the challenges, as you'll know from the kind of within the health economy, is how do we reach people? How do we reach people who are on the margins, the people who've got some of the poorest health and also some of the least resources? So we put in some money and we got everyone, well, 12, we secured 12 laptops, and we were going to buy printers, but printers are rubbish, it turns out, because no one needs printers these days. So instead what's going to happen is they're going to buy some portable Wi-Fi. We've got them a year's worth of unlimited data, so either Wi-Fi or at home. And most of the organisations have opted to get a Wi-Fi router with unlimited data that they loan. They pass around, hopefully, having been sterilised beforehand. But yeah, they loan around to people to say, well, you've got access today, tomorrow, whatever. But this will also hopefully enable people to be able to play into some of those conversations and some of those consultations they're having within health at the moment about getting messages into the communities in ways that people understand around the ever-changing guidance that we're given, but also around how to be able to get online to see your doctor. If you need to get online to see your doctor, you can borrow the laptop and you can borrow the Wi-Fi router and you can have your consultation. So it's trying to facilitate that. So it's from both a refugee perspective and also an asylum seeker perspective. I started out with the stories. My missus said stories count more than facts. So they're also factual stories, but hey. So next up, my point was that poverty equals data poverty these days. I know we all know this, but people who are on asylum support get 52% of income support in old money, which is now. And we can't assume that people have got accommodation where even stuff that's provided by the state, we can't assume that there's Wi-Fi or even telly. You've got Wi-Fi or telly, how do you get through lockdown, right? So people are generally, and many of the people that we know, asylum seekers, refugees, rely on the free stuff that's out there when you can go to those places. And so during lockdown, that's been particularly difficult. The council's not been open. The McDonald's, you can't just hang around outside and jump on as been usual. So it's an enormous challenge for people. The other thing that we found in the last few months is that getting data to individuals is particularly problematic because although during the best deals are like for just like Joe and Jill Public, and you can sign up for them, pay as you go. Smarty's a really great example, 20 quid a month, unlimited data. You need a bank account. Many of the people that we know aren't allowed to have a bank account by law. So what do you do with that? You can't pay for things with a card. So the whole idea of exclusion, digital exclusion, coming from poverty, but also other kind of policy decisions is quite significant. The other thing as well is if as an organisation we chose to buy SIM cards for people, that also, there's a load of risks that go along with that because it's in our name. So if they're doing stuff in our name, then if something moody's going on and I don't know, they're downloading stuff that they shouldn't, then it's our door that gets kicked in, not theirs. So it's a challenge. One of the things I do in my spare time is I help out at Solidaritech, which is a small not-for-profit, and we repurpose tech. Anyway, the point being is, right at the start of lockdown, we did try and do this whole thing about block purchasing SIM cards in order to be able to provide to other agencies. We took out insurance to make sure that that was underwritten. So, and we also took steps at the server end to stop to be able to put child filtering stuff on and to be able to stop the adverts being pushed to make the most of the data that was available. And that was all going swimmingly well, and we thought we could provide it at a price that's right to local authorities and NGOs. And then O2 decided to shift the goalposts, and they started to charge us a lot more money, and the model broke. Because we weren't paying them enough money and they weren't making enough profit. I'm getting to the end of the segment. This was a bit about saying that you could, if you wanted to be helpful, you could try and repurpose your old kit from wherever you worked, but I'll leave that by. We set up a whole distribution network with the assistance of Amy and 100% Digital to be able to do that. My final bit, it's really important, this is about my mother-in-law who's passed now, God bless her heart. She had COPD, and she had this little kind of thing with a circle around it. That's an oxygen concentrator. She had one put in her house by the NHS. And when she had it put in her, she had a health need, right? For this, with her COPD, provided with oxygen up the nose. Point being, when she had this installed, they said, well, it's going to affect your electricity supply. Now, her income was 45 grand a year. She didn't have any housing costs. And the NHS paid for her electricity to fund her oxygen concentrator. Fair play, because you should get what you need through the health service, right? 45 grand after housing costs, and we managed to pay our bills on the lecky, and we can't find £5 a month to help impoverished people who are on 50% of income support rates to be able to get online. So I want to leave that with you, just as a thought. Take it to governments and see what we can do, pressuring government to see access to digital as being an essential part of the healthcare economy. That's it.
Thanks, John. That was a really important message for us all to hear, I think. In fact, there was several important messages in there for us to hear. Thank you. Now, last but not least, we're going to have Charles Crossland and Mark Hollingworth, who are from Kirklees Council. And there's an awful lot of activity going on in Kirklees around access to digital. And they're going to talk specifically around access to digital tools in a care home context.
Good afternoon, everyone. Thanks very much for your time. I'm here to talk, as was just mentioned, about Kirklees' response to digital inclusion, and specifically what we've done around increasing equipment as part of our IT strategy. Okay, so our journey very much began and was underpinned by our IT strategy. During the start of 2020, we developed a new IT strategy, and it was different from other traditional models. It strove to see how technology can be used to make a real difference in people's lives. Terence Hudson, head of IT, at the beginning of March, went to our council's executive team, and the IT strategy was approved. The strategy was based around 7 key ambitions, one of which was developing inclusive technology and skills. Giving people the skills and technology to interact online, apply for jobs, access council and other online services, and get basic skills they need was a key element. The onset of COVID-19 very much focused our minds, and we started to quickly move to deliver the strategy. Across all areas, we deployed towards 3,000 devices, including 2,000 DFE funded devices for vulnerable children, and devices supplied for almost 350 foster carers and children. In terms of specifically around adults, within the care home setting, we had a range of devices that we deployed. 60 Facebook portals were deployed to private sector care homes across Kirklees by Age UK, NHS and Facebook. These were deployed so that residents can stay in touch with loved ones and reduce their social isolation during the coronavirus lockdown. The devices also deployed to support medical assessment and linking up with GPs and doctors' surgeries. Tablets were also deployed within the Kirklees care homes, offering ability to video conference with family or access a range of wellbeing applications, such as libraries ebooks, which are incredibly popular. In terms of adults with learning needs, in daycare dementia, 4G tablets were used where we could, so that we can access online services, which weren't currently possible because daycare was currently closed. Again, with disability living, tablets and Facebook portals were used so that we could support residents in disability living as a proof of concept. We also worked with supporting wider adults and community groups. TechForce 19 bid was used to develop an application for Age UK to support befriending via a grant from bid. We also work with vulnerable adults and children that are identified through community hubs. During the early doors of COVID-19, volunteering groups targeted a range of support and devices that were supplied. And finally, voluntary community groups. A range of devices were supplied, phones, tablets issued to groups, supporting a range of community responses, including supporting dementia supporting charities. In terms of where we're going from here, we've got work on the carers' digital strategy. We're engaging and consulting carers, understanding their needs, what training, support, devices, connectivity we might require that would help change their world. We're enhancing the facilities within the care homes, building on the positive feedback from families, residents and staff. We're introducing some additional changes, including devices to support residents' wellbeing, streaming live in the concerts that are in our town halls. We start streaming those in now. We're also looking to provide video conferencing between the rooms within the care homes so that people in separate bubbles and socially isolated are able to sort of engage and talk to each other where they can't actually see their friends because they're in different bubbles. We've also started to develop a relationship with one of our local colleges, actively working with Kirklees College, developing a learning partnership, supporting our digital inclusion ambition. We're forming a digital inclusion group across Kirklees too, bringing together employment, skills, health, social care and education. This will include voluntary sector reps as well as college and university partners. And in terms of the key learning points, first one being cross-sector and cross-sector engagement, we see as really important. Engaging partners sector-wide, making sure that we work together for greater outcomes. Ensuring that our risk appetite needs to be higher. We need to challenge ourselves to take risks to make things work. If it doesn't work, it's important we recover quickly, but also learning through new technology options that are out there where traditionally internal IT departments may have been a little bit shy on. We need to look at rapid deployment of equipment, taking those risks, making things happen quicker so that we can make a difference now, but also be mindful of sustainability, thinking about what we can deliver now that can be sustained for the future. And finally, be brave and be more extrovert. Don't just do things for looking at internal services or council groups, but think about the wider public. Think of those people that make our borough and places an interesting place to work and play. Thank you.